Hi everyone, my name is Francisca and today I'll be giving a presentation on chronic diseases and I'll be majoring on osteoporosis. This is a brief outline of the presentation, starting with the introduction, the pathophysiology of osteoporosis. I'll go on to talk briefly about the signs and symptoms, touch on the risk factors, diagnostics tools, statistics, and prevention of osteoporosis, and then the medications for treating this chronic illness. I will also touch on disease processes associated with osteoporosis and then patient education for osteoporosis. So, some may wonder what a chronic disease is. A chronic disease is a disease that usually lasts from 3 months to lifelong. Lifelong here means that usually there is no cure for chronic illnesses or diseases, and so a person suffering from this usually lives with it for the rest of their life. Chronic diseases have cascade effects. Yes, usually one effect of the disease leads to another disease on its own, and that's what is referred to as cascade effects. And cascade effects are usually what impact a person's quality of life because you have one thing and it keeps leading to another and another and another. Talking on the quality of a person's life, for instance, osteoporosis could affect a person's ability to engage in sports or physical activities, and so that's one quality that could be impacted. Also, examples of chronic illnesses or diseases are asthma, diabetes, osteoporosis, which I will touch on today, arthritis, cancer, and depression, among many others. Now we'll go on to talk about the pathophysiology of osteoporosis. So before I touch on that, bone is what makes up the human skeleton, and bone is a mineralized connective tissue. Yes. So osteoporosis occurs from the imbalance between the activity of the bone cells. There are many bone cells, but for the purpose of this presentation, I will be mentioning three. So the first is osteoclasts. Osteoclasts. Osteoclasts are the bone cells responsible for damaging and dissolving old bone tissue, while osteoblasts form new bones and add growth to the existing ones. Osteocytes are the mononuclear precursor cells. So basically, all other cells come from the osteocytes. So with an imbalance in activity between osteoclast and osteoblast, it means that there is too much bone being broken down as compared to the amount of bone that is being replaced. So it's like too much is being taken out than what is being replaced, and that's what leads to a decrease in the bone mass, resulting in osteoporosis. Signs and symptoms. Usually, osteoporosis does not show signs until the person experiences a break in their bone, but sometimes when you experience any of these signs that I'm about to mention, it could be a warning that your body is giving to you that, hey, you have to get this checked out because you never know. So the first is loss of height. The loss of height occurs because of the compression of the vertebrae. And so if you notice that your height is reducing usually by an inch or two, you should definitely go and have that checked out. Also, the compression of the vertebrae can cause shortness of breath because the vertebrae being compressed also reduces lung capacity. Sorry. Yes, other symptoms are pain, localized pain in the neck, in the back, in the hip or spine wrist area is usually an indication of osteoporosis. Brittle nails and fingernails are also a sign of osteoporosis. Predisposing factors for osteoporosis. Poor or inadequate diet. Usually, malnourished people or people who do not incorporate all the necessary vitamins such as calcium in their meals are found to have weak bones, and so poor or inadequate diet could result in somebody having osteoporosis. Age. It has been proven that people over the age of 50, both men and women, are more prone to having osteoporosis because as they age, their bone density naturally reduces. Sedentary lifestyle. For instance, people who work from home, people who spend long hours sitting in one position, and people who don't stretch or move about much in their daily lives are also prone to having osteoporosis. Smoking. According to a study, women who smoked one pack per day throughout adulthood had 5 to 10 reduction in bone density by menopause. As a result, smoking is a risk factor and should be avoided if nobody wants to have osteoporosis. Alcoholism. Alcoholism is another predisposing factor to osteoporosis. Vitamin D deficiency. Vitamin D could be gained through exposure to the sun, and experts recommend that females and males over 70 consume 20 micrograms of vitamin D supplements daily if they do not have access or if they are not able to spend time in the sun every day. Endocrine disorders such as hyperthyroidism, hypothyroidism, and hormone imbalances could lead to less amounts of calcium deposits in the bone. Diagnostics tools. An X-ray could be used to assess the density of bone, and physicians or qualified professionals through the X-ray images can see where a person's bone mass has reduced. A bone density test could also be used to diagnose a person of osteoporosis, as well as a quantitative computer tomography. The statistics for osteoporosis in the United States. Osteoporosis is the most common metabolic disease in the United States, and according to the International Osteoporosis Foundation, 1 in 3 women over 50 and 1 in 5 men over 50 will suffer from osteoporosis fractures. Types of fractures include green stick fractures, comminuted fractures, closed fractures, open fractures, and so on. The disease affects roughly 6.3% of men over 50 and 21.2% of women over the same age range globally. From this, we can see that women are more prone to osteoporosis. Given the number of men and women on the planet, this suggests that approximately 500 million men and women are affected worldwide. The table above also shows the ages between which people are more prone to osteoporosis. Prevention. Many steps can be taken in one's life to prevent the occurrence of osteoporosis. Sun exposure. Sun exposure gives the body vitamin D. Vitamin D helps reduce bone loss and the rate of fractures. And so sun exposure about 15 to 20 minutes every day could help increase vitamin D levels in the body. Another way to prevent osteoporosis is to stop smoking, because smoking increases the risk of osteoporosis. Regular exercise. Regular exercise strengthens the bones and helps a person to keep fit. Avoid alcohol consumption. Eating calcium-enriched foods. Calcium-enriched foods such as dairy, cheese, milk help a person to strengthen their bones and moreover their teeth, which in the long run reduces or prevents the occurrence of osteoporosis. The final point here, which is most important to me, is regular checkups, because even if you eat well and exercise regularly and avoid alcohol and get sun exposure, due to genetics, you might still be prone to getting osteoporosis. And so the best way to know this is by having regular checkups, having annual physical examinations, and that's another way of preventing osteoporosis. Diseases related to osteoporosis. As I mentioned earlier, osteoporosis could result in a cascade effect of other diseases, and that includes cancer, hyperthyroidism, and celiac disease. For instance, bone cancer or tumors cause the bones to replicate at abnormally fast rates and could result in more bone deposited than bone taken out or destroyed. Hyperthyroidism. Hyperthyroidism could also come into the picture as a result of osteoporosis. Celiac disease as well. And another disease related to osteoporosis is obesity. It has been found through studies that people with higher BMIs, obese and overweight people, tend to be more prone to getting osteoporosis. Medications for osteoporosis. Various medications exist that can help in the treatment or management of osteoporosis. Because osteoporosis is a lifelong disease, there is currently no cure for osteoporosis. Some of these medications include denosumab, rituximab, anabolic agents, risedronate, zoledronic acid, and ibandronate. Patient education. The following are some of the steps that the nurse or primary care physician can educate the patient on concerning their condition. Avoiding falls. Falls are known to increase the probability of somebody fracturing their bones. And so, an osteoporotic patient is advised to avoid falls. This can be done by taking out slippery substances from their rooms, making sure to not walk over wet floors, and also to wear shoes that have good grip on the floor. Avoiding alcohol consumption. Patients with osteoporosis are advised to avoid alcohol consumption or limit consumption to 1 or 2 glasses per week. They are also advised to avoid smoking. Patients with osteoporosis are to be educated on the essence of taking their medications as prescribed. Many of these medications listed interfere with other drugs, and so taking them as prescribed by their doctor is very important. Exercising. A patient is advised to get about 30 minutes of exercise every day or about 4 days a week of exercising. The exercise doesn't have to be stressful or burdensome, but some activity every day is better than none. Calcium intake. The patient is advised to incorporate more dairy products, more milk in their daily diets. Vitamin supplements such as vitamin D is recommended for people over the age of 70. Physical therapy in conjunction with medication provided by physicians is also another way through which patients with osteoporosis can manage their condition. Patients are advised to make lifestyle changes such as losing weight, which will reduce their BMI and also reduce the risk of obesity. And for already obese patients, it has been found that losing weight reduces the pressure that is put on their joints and relieves pain. Wear loose fitting clothes. Thank you.